So the next technique is the thoracic inlet. And the intent of this one is to mobilize any of the fascia right here at the cervicothoracic junction. So the way that we are going to go about doing that is we're going to place our dorsal hand just ahead of the withers, which is kind of hard to see. It's just a big old standardbred girl. Not a lot to hang on to there, but so we're just going to go cranial to the wither there, nice and fleshy area. The ventral hand is going to cup the manubrium. So I'm just using the fleshy part of my hand to sort of cup that point at her manubrium there. This thumb is always hanging out. And what I'm using is my middle finger to follow the line in between her pectoral muscles and heading caudally. And I'm just going to place my hand ever so gently there, cupping her pectorals on the manubrium. And using that. Can be a bit of an awkward hand placement, but getting the sort of wrist to head nice and square is why I like to use my middle finger right along that line to make sure that I'm sort of following that path naturally, caudally.
Not only does releasing this diaphragm assist with the proper functioning of the forelimb, we can also affect some change for other contents in this area, such as the trachea, esophagus, arteries, veins, the brachial plexus, and cervical sympathetic ganglia. The phrenic nerve, radial nerve, and lateral thoracic nerve are all housed here.
Ventral hand, a bit less in the dorsal right now, but we'll get there, won't we, pretty girl? There we go, there's the hand placement. So ventrally along cupping the manubrium and heading caudally with the left hand. And then dorsally, that hand is just right ahead of the withers on the fleshy portion.